Good evening. Thank you for attending our first LGBT health fair, which we've called Come Out for Your Health. We'd like to thank our participating members, our community members, partners in the greater Jackson area for helping us with this evening. And I think I am going to just say, my name is Tom. I'm on the board of directors from the Jackson Pride Center. We have events pretty much once a month, if not twice. This month we've been having one or two a week, so it's been extremely busy. We wanted to give everybody a chance to ask questions online and in the audience of any of the presenters. If there's a specific question that you don't feel comfortable asking, we can watch you online and we will ask the question for you. See, we're nice like that. Again, thank you for coming, and I'm going to introduce and speak about our first presenter, which I guess technically would be me. But I'm speaking on Doreen's behalf for the Center for Family Health, excuse me. Located at, is it 505 North Jackson Street, directly across the street from station, was it 2? The fire station and United Way. Just south of the Keeley Center, formerly known as the Jackson Fairground, which is the corner of Gampton and Jackson. All right, Center for Family Health. They want you to know that they have quality, affordable care. They accept all insurance plans, including Medicaid and Medicare. All services offered at the Center for Family Health are available on a sliding fee discount, so never be afraid to get care if you can't afford it. Patients are never turned away due to their inability to pay. The Center for Family Health is an independent, federally qualified health center. They provide comprehensive quality medical, dental, and behavioral health care. Some of the services for the entire family include pediatrics, women's health, family medicine, dental, pharmacy, counseling, case management, nutrition counseling. Ooh, I'm going to have to come see you. Medicaid enrollment on a walk-in basis. They do have transportation services and legal aid services. These services are only available at the downtown center, which is pediatrics, women's health, pharmacy, and nutrition counseling. But all patients from all locations can access them there. Does anybody have any questions for the Center for Family Health? No? Okay. Next, I am going to introduce Tracy from the Area Agency on Aging, Region 2. Please put your hands together for Tracy.
Thank you. Everybody hear me okay? All right.
Yep.
Thanks for having me. I'm the Area Agency on Aging. We're located in Brooklyn, not far from here, right downtown, right in the corner of the square there. We are a not-for-profit agency, and our coverage area is Jackson, Lenawee, and Hillsdale County. So that's what Region 2 is. It's kind of our little corner of the world, Jackson, Lenawee, and Hillsdale. There are 16 area agencies on aging in Michigan and over 600 nationwide. So no matter where you go, you're going to find an area agency on aging. It might be called something different no matter where you go, but you're going to find an agency like ours. So the population that we serve basically is those who are 65 and over, or those who are 18 and over with a disability. So older adults and younger adults with a disability. A lot of our programs are free of charge. There are some very small costs to some, but all of our programs are designed to help people stay at home, independent, and safe for as long as possible. We have programs designed to help people go home from nursing homes if that's what they want to do. We work a lot, our biggest program is the My Choice Medicaid waiver, so if somebody has Medicaid, it's an all-inclusive in-home service that helps them stay at home and have whatever service they need in order to stay there. We have other things that, just help people just be independent and safe and active in the community. And if you have questions for me, I'll take them. If not, I'm here. And also, I just wanted to give a shout out to those folks who might be watching online. We do have a website. It's r2aaa.net. And you could always call us at 800-335-7881. And I'm sure you can call any of us and we can sort of refer to each other and get you the information you need. So, are there any questions? Yeah.
Yes, Tracy. What kind of services are you able to help the senior community find in terms of maybe like adult daycare, or are you able to do that with your?
Yes, we don't do anything like that at our office. Our office is, we have about 60 people that work there. Our office, if you can think of it as, we're sort of an information and referral center. We do provide a lot of the services in homes, but one of the biggest things that we do and the way that we help the community is sort of we take those phone calls, we take those online questions, and we just help refer people to the right place. We don't necessarily do all the work ourselves, but our information and referral specialists are wonderful at hooking people up in all 3 of our counties with whatever service that they might need.
Cool.
Including daycare.
Oh, perfect. Thank you.
Anything else? Okay. Thank you.
Thank you so much. All right. Our next presenter is here from Home of New Vision. Please welcome Nathan to the stage.
My name is Nathan. I am a recovery coach at Home of New Vision. I am in recovery myself. That means I haven't used any mood altering drugs or drink in almost 6 years. I work at Home of New Vision. We are a non-profit recovery resource center. We focus mostly on prevention and education. We are here just to help you to get involved. We educate you on addiction and recovery, to be your support. We're here to walk you through it, walk with you, to do it with you. We offer quite a bit of different things. The biggest way and easiest way to get plugged in with us is to come down to our office. It's at 407 West Michigan Ave. It's the parking lot of the So-and-So shop. It's the big Victorian mansion. We do a recovery bistro from 10:30 to noon every Monday through Friday. That's free coffee. It's open to everybody. Just come in, get some coffee and some fellowship. And if you're new, we'll see you. We'll pull you to the side and we'll let you know what's going on and get you plugged in the best way we can. Answer any questions we can for you. We do a lot of different kind of groups, from an engagement group to a refuge recovery. These are just groups you can come, join some of your peers, get some education, meet some people. Every Saturday night we do we call it a wrap party. It's a recovery after party. It's just sober fun. We provide some food, some kind of entertainment or games, or a bonfire if the weather allows it. This Saturday we have what's called Recovery Is, and that's a speaker bureau of 5 people, I think, and they'll each tell you the story of how they got sober, which is a little bit different. After that, we'll do a barbecue and then have a parking lot dance. That's from about 3 to 8 on this Saturday. I think that's it.
Got a question. Question is, are your groups like LGBT friendly? Are there any LGBT specific groups?
There's none specific, but we are open to everybody. Everybody's welcome. It's a warm, welcoming atmosphere. We have a lot of LGBT people that participate with us and are there on a regular basis already. So yeah, just come on in and
Perfect. All right. Thank you so much. All right. Our fourth speaker is here from Aware. Please welcome Lane to the stage.
No. What about now?
Yep.
You can hear me?
Yeah.
Great. So I thought we were going to impress by saying we had a mansion, but apparently we're not the only one. So we do have a mansion though, so be impressed. So all of our services at Aware are free and confidential. We are a domestic and sexual violence agency, so we provide services to anyone who's experienced domestic or sexual violence. That does include at our shelter. And I want to be very clear that our shelter is open to anyone, regardless of gender identity or sexual orientation. So keep that in mind when you think about our shelter. But our shelter is not the only thing we provide. It's about 40% of our services at the shelter. So I want to make sure you know about those for today as well. So we'll start with the shelter. It's not necessarily like interface, if you're familiar with the structure there. It's a big house, and there are just individual rooms. They're broken up. They are shared, but it's not like a big open space. So you'll have individual rooms and then private bathrooms. And then additionally at the shelter we have a helpline. So this is 24 hours a day, 7 days a week that you can call for referral, for emotional support, for access to any of our services. If you have any questions about our services, you can call that line. What else do you have at that line? Oh, also if you're looking for shelter, that's the line to call. Additionally, we have a counseling center, so we provide individual and group counseling, both for domestic and sexual violence, and a kids club. So this is for children aged 6 to 12 that have witnessed violence in the home. And there's a closed group that meets once per week, and then I think there's different activities as well. We also have the Jackson County Family Visitation Center for supervised visits and safe exchanges with parents and children. That is held at over by Center of Court. We also have legal advocates located in the county clerk's office on the first floor of the court building. They can help with filling out PTOs and providing court accompaniment. And they provide support and encouragement during court processes. Finally, we have community sexual assault services. We continue to provide the sexual assault accompaniment if you have a family plan to go to, which is sexual assault mass examination at the hospital. We do have accompaniment for that, and also some services and support that follow up from those exams if someone would like. And then if there are some follow-up visits that take place, we can also accompany for those visits. Finally, we have Aware volunteers. So if anyone wants to volunteer at the shelter, you can certainly talk with us. We have a website, awareshelter.org, or you can call, or you can come down. We're at 706 West Jackson, West Michigan, in Jackson. And so we're just right down the street. You can come down and see us. If you would like to make donations, which I know a lot of people ask us about, we do have a list online of what is needed at this time, so please feel free to visit there. Again, that's awareshelter.org. And I think, oh no, the other thing is we have a new project, which I'm the Sexual Assault Services Coordinator, and I'm also the Sexual Assault Response Team Coordinator for Jackson County. So that's a new service that we have. We are partnering together with anyone who responds to sexual assault, so that includes the prosecutor's office, all of the law enforcement agencies in the county and city, the forensic nurse examiner's program at the hospital, and then a lot of other agencies that would work with anyone who's experienced with sexual assault. So we're working together as a collaborative team to improve our response to sexual assault in Jackson. If you have any questions or know of an agency that should be involved with that, it's called a SART, the Sexual Assault Response Team, and feel free to let us know if they should be involved. Any questions? Yes.
I'm going to ask questions of everybody. Near.
Good.
Okay, did I hear correctly that you offer counseling to not only victims in the shelter, but to anybody that has experienced domestic violence or sexual assault? Is that correct?
I'm so glad that you asked it. So any of our services are available to people in the shelter, but all of our services are available to someone who chooses not to stay in the shelter as well. Thank you, Brad. Anything else? Great. Thank you for your time.
All right, thank you, Lane. Next, we're pleased to bring up to the podium from Planned Parenthood of Michigan,
No.
Ethan.
You skipped.
I'm sorry, bad Tom, sorry. I flipped the page wrong, I'm sorry. Okay, actually, I'm gonna bring up ARE, which I am thrilled to have been at our first meeting, for the LGBT support group. Thank you so much, Bree. ARE Inc. of Jackson and Hillsdale. Please welcome Amanda to the stage.
Hello, everyone. How are you guys? Good. Good. So ARE stands for Activity, Recovery, and Empowerment. We are a peer-run organization, so that means our board of directors down to our volunteers all have a mental health diagnosis. We also work with substance use disorder community as well. We have a couple different services I want to tell you about tonight. We have a drop-in center in Hillsdale and Jackson. The drop-in center is a place where members can come, take recovery groups, support groups, have a meal, socialize. We have pool, laundry available, gardening group. We have a LGBT group, we call it A to Z. Because we mentioned all the letters, we just got too much. So we're A to Z, every Friday from 10 to 11. And then we also have recently started one in Jackson, and that is every Tuesday from 4 to 5 o'clock. We also have peer support, and that means a certified peer support specialist has a lived experience with mental health, and they work with their peer on a one-to-one basis on the recovery goals. Peer support partners, they walk alongside parents of special needs children, offering them support only a peer can give. So it's, I've been there, I've done that, this is what I've done to get through, and they support peer. Our support and recovery groups, they are pretty awesome. We have a dual recovery group for both mental health and substance use. We have a Hearing Voices group. We have anxiety, depression group, the walking group, gardening group, and also, like I mentioned before, our LGBT group. And we're also working on a peer respite as well. That will be a low trauma, low cost respite for people experiencing crisis. So we have a lot of different services, and essentially the drop-in center is a place for people to go. It's a safe environment, not judgmental. Everybody there has been through mental health, they understand, and it's a place for them to go socialize and just be who they are. So that is what we do. Any questions?
Okay, yes, I'm going to ask a question again.
Okay, that's okay.
Now, I understood correctly that anybody that identifies as LGBTQ or an ally can attend that
Absolutely.
support group? Okay.
Yep. And the beauty, too, of the group is that it's peer-run. So with somebody who is also part of the community.
Perfect.
And that is all with all of our groups. They're all peer-run, so everybody who facilitates the group has been through that before. And they help other members do that road recovery.
Okay. Well,
Thank you
wonderful.
so much.
Thank you.
So sorry for skipping over you. That was so satisfied. I'm so embarrassed. Okay, now we'll bring Planned Parenthood of Michigan. Please welcome Ethan to the stage.
Thank you so much for having me today. We have a clinic here in Jackson. It's right over on West Michigan. It's about 4 minutes away from where we are right now, so it's very, very close. But I'm also here representing all 19 health centers all across Michigan. Planned Parenthood of Michigan really believes in reproductive health care for all Michiganders. And our goal is to provide that health care. Our goal is to provide sexual education. A fun fact about us is that we are the largest provider of sex education in the entire country. And we strongly believe that we also need to have advocacy to ensure that this is accessible by every single Michigander as well. Because we could be the best educators in the world, we could have the best resources in the world, but if you can't afford to be there, then it's no good to the entire state. And so that's the mission that we have. The services that we have vary wildly, and so I'm not going to go over every single service that we provide, but in case anybody has specific questions, we have these cards at our table that go over every single service in the Jackson Health Center specifically. But for the most part, what we provide is education. We provide a lot of birth control. We provide STD or STI testing. We provide abortion services. and a whole host of other services that people often don't know that we do. And we specifically tailor to the LGBTQ community in a lot of different ways. And I think the first and most important way is that in order to work for Planned Parenthood, you have to get extensive training on the LGBTQ community. You have to. This goes through the entire so the LGBTQAIP community specifically. So they're trained on every single letter of that alphabet, what it means, and what everybody goes through in those specific areas. So for example, you can say, oh, everybody's welcome, and it's important that everybody's welcome, but if you don't understand what they're going through, then you can't give health care in the best way possible. It's important to understand that if you are a trans woman in this country, you are at much higher risk of sexual assault or physical assault. So when somebody walks into your room, you have to know that their experience might very well be in this area. That you have to be prepared to handle this, to speak to them in a way that understands their experience. And you have to hire staff members who understand their experience as well, and staff members who represent the community that we're trying to train. It is also important to realize that our health center forms help the LGBTQ community by allowing them to put their preferred name on that form, so the doctors never call them by the wrong name or the dead name. We ensure that they're allowed to put their preferred pronouns on their sheet too. We ensure that the medical professionals introduce themselves by their own pronouns. So for example, I am he, him, his. I even wear the shirt to help you all, in case you need it. And it is important that when we go through this training as well, we also advocate for this community, and we don't leave them out when we're trying to give an issue. So for example, there are men with uteruses who have to get abortion services, and when we speak on stopping the ban, we speak in our rallies, we ensure that their voices are front and center in this battle too, that we don't say just that this is a woman's issue, because there are people who identify as women who identify as men who this affects as well. So we have a lot of different ways that we want to ensure that we support the LGBTQ community, and it's also reflected in some of our services as well. So we know that PrEP is a really important service for the LGBTQ community. We've been expanding it all across our state. So it is now, I know it's in Lansing for sure, and in 3 other health centers across the state. And we're working on making sure that hormone replacement therapy is something that we're going to offer by the end of the year as well. So we were working very hard to make sure that it's not just that we train people, it's not just that we hire the right people, it's not just that we advocate, but that the services are really tailored and helpful for those in the community as well. And then last but not least, if the services aren't affordable, as I mentioned, then they're not really any good. So we do take almost all insurance, including Medicaid, but we also offer, in case self-pay is an option that you have, so 53% of our patients use self-pay. And what we do is we offer what's called a sliding scale, which means that we go through a series of tests, we ask you some questions, and we determine how much can you afford to pay for the service. And then we charge you based on what you can afford to pay. And that is often very helpful, especially for people who might even have insurance, but maybe it's through their parents. And they don't necessarily want their parents to know, or their parents aren't supportive. We will talk them through it, and we will make sure that we are there for them. But the most important thing that I want to leave you with is that everybody that works for our health center really, really cares. And I was just at our Jackson Health Center before I came here, and I remember how they were talking about how some patient's stepdad was trying to yell at them. He's this big, hulking guy. But what ended up happening was, and she was trying to pretend like she was all tough, and she's like, screw him, and all this other stuff. But then at the end, she talks to me about how much she was so happy that she got to help that person in the back room. That even though the stepdad wasn't supportive, she was able to give the daughter education that she needed. And ultimately, that's what we bring to the table more than anything else. We bring a staff that cares, a staff that listens, and a staff that is always there. So we are proud to be here, proud to represent, and we just want to thank everyone for letting us come here as well. So thank you all. We really appreciate it.
Don't leave yet. Don't leave yet. We have questions.
I'm ready.
Okay. You spoke about hormone replacement therapy being available by the end of the year. Would this be offered in Jackson?
We're not sure yet, so a lot of it depends on where we're able to hire the qualified medical professional.
Okay.
So oftentimes what we'll do is we'll find a medical professional who's qualified in, let's say, Ann Arbor, and then we'll travel to different areas around the state.
Okay.
So I can't promise that it will be in Jackson specifically, but at the very least we'll be able to refer in Jackson to different areas across the state.
Okay. And then on the same token, PrEP. You said it's available in Lansing.
It is.
Will it eventually be available in Jackson?
We are hoping that it will be. Again, a part of it is just where the qualified medical professional is going to be. And sometimes what we'll do is we'll have people travel from Lansing to Jackson on certain days to offer certain medical services. So So I'm afraid that as of now it's not available in Jackson, but we're always doing our best to make sure that we can allow our medical professionals to travel in between states. But a lot of it depends on what they can do and what their schedules are. And unfortunately, it's not always available in every area.
Let's talk.
Okay. Any other questions from people?
Not back.
Oh. Okay.
Thank you, sorry. If a, individual is a resident of Hillsdale County, do they still go to the Jackson County?
So the question was, if someone's a resident of Hillsdale County, can they go to Jackson County? If anybody is a resident of anywhere, they can come anywhere to Planned Parenthood. We don't ask you where you're from when you're coming here. I would say a lot of patients do travel, especially if they really have a relationship with some of the doctors that we have. They travel all the time. So sometimes it's good to go to the one that's closest to you, and sometimes you're like, no, that's the person I know. They treated me very well, and especially in the LGBTQ community, when there's such a high fear of going to the doctor, when so many people in the LGBT community don't go to the doctor. For example, gay men are half as likely to go to the doctor when they have a medical issue because they're so afraid of discrimination. Sometimes it's good to have medical professionals that you know and trust. So we accept people from everywhere.
That's wonderful, thank you so much.
You're welcome.
What are your business hours?
And
I spend.
you might have stopped me. The 19 health centers might get confused. Come to the table, and I will give you a written sheet with all the health center hours. Darn, I almost made it.
Yep.
Anybody else have any questions? All right, put your hands together. Thank you so much.
See, it's not only the audience and people on Facebook getting an education, but I just got an education myself, so it's a good day. It's a good day. All right, next, I want to bring up from Unified HIV and Health, please welcome Karen, one of our community partners.
Hi, can everyone hear me okay?
I'm not sure.
No, can you hear me?
There you go.
Guys,
There you go.
okay. My name's Karen Mahler, and I'm from Unified HIV Health and Beyond. We have locations in Detroit, and we just have a new office there. It's at 3968 Mount Elliott. We have an office here in Jackson. We're at 211 West Hanson Street in the United Way building. We also have a location in Ipsy, Ypsilanti, Michigan. The address is 2287 Ellsworth Road. So we are a nonprofit, full-service organization that helps individuals living with HIV or who are seeking services. You can come to us at the Jackson location for case management. People often ask, what is case management? Well, my job is to help you get from your diagnosis to wellness. And oftentimes that pathway is filled with barriers. Sometimes, you may have stopped engaging in care. You might not understand your diagnosis. You might need more education. So you're always welcome to come and see me there. Anyone have any questions?
Of course I do. I know you offer case management, but could you also speak a little bit about housing and how it applies with like HOPWA? I know that Felicia's not here tonight, but if you could speak a little bit about HOPWA and housing and also your pantry that you have.
Okay. So we have a housing specialist named Felicia. So often what you'll do is you'll come in and you meet with me, and if you're having trouble with housing, I'll do a referral to Felicia. And it's a really relaxed environment. We're very friendly, we're really welcoming, so I want you to know it's a safe place for you to come. People also often have, challenges getting access to food. So we have a food pantry as well.
All right. Anybody else have any questions? All right. Trust me, it is a nice and safe atmosphere. I probably spend more time in their office than I do my own. All right. Please, Karen.
You made it. All right, and the last presenters we have are from the Jackson County Health Department. Please welcome Jennifer to the stage.
is one piece of what we offer at the health department. We have low cost, no cost screening for sexual health. We have free condoms. We have HIV testing that's free across the board with 20-minute results. We have a great referral system. It's called The Hub. So it's a closed loop referral, so it's not us handing you a piece of paper. It's you being able to go out and tell us what you need, and us sending out referrals to the people that participate with our program. So it could be housing, it could be food, it could be care, it could be a number of things, and we will actually send that to people who participate in the program, and they will get back to you within 3 days. So you're not running around with a piece of paper trying to figure out who you need to see and who can help you. In the Jackson County Health Department, we are located at 1715 Lansing Ave. We have the veterans are in there. Our maternal health is in there. We have the Commission on Aging, they're in the middle. We're like ground floor and then second floor, and they're in the middle. They do their thing. And then we have the WIC program. We have Smiles on Wheels, which is dental for children and adults. Yeah, to get my confirmation, they're over there. Yes, right. We also have the WIC program. We have hearing and vision screening. We have, oh yeah, immunizations, the other part of what is in our clinic there, for adults and for children. Is that about it? I think that's about it. I think that's a lot. There's a lot going on there. If you have questions, you can call us. We are a walk-in clinic, so you don't have to make an appointment. It's a great atmosphere. Our public health nurses are wonderful. We just want to help everyone in the community and get what you need, get the care you need, and help you with really anything that you need to be able to do that. We're really proud of them. Great team. Yes, Tom.
Of course. Now, with the recent measles outbreak, did you see an uptick in cases here in Jackson County? And I'm going to put you on the spot. You don't have to answer me now, but those of a compromised immune system or advanced in age, were they some of the I guess the harder cases to deal with measles, or have you seen it at all?
This is bad. If we just had a meeting, we haven't had any in Jackson.
Well, thank goodness.
Yeah.
That's good. Okay. Okay. Cool.
Oh, and we do some outreach. Yeah, a few centers and a couple of facilities.
Would you be willing to come back and, all of you, would you be willing to come back and speak with us at some of our meetings that we have, like our board meeting, what is it, the fourth Wednesday of the month?
Mm-hmm.
Fourth Wednesdays of the month.
Yeah.
We have speakers, like designated speakers, and we would love to have you.
Sure.
And,
we're looking to partner with the community. Like I said, I've only been there a short time, so we're reaching out. So this is a great event for us to get to network and to meet people and figure out where the needs are and what we can help with.
Well, you hooked up with the right folks.
All right. Yay. Thank you.
Thank you.
All right. Just a few comments. I know I put some people on the spot, and I do apologize. And I skip rotation, I know. But we just want to let you know that in August, we have our Pride Week coming up with our festival, our third festival of the year, coming up on Saturday, August 24th. And I know we'll have everybody present there. So please, if you weren't able to make it tonight out there in Facebook land, or if you don't have information, we'll put up all of your information that you're willing to give us up on our website, as well as the event page with contact info, numbers, etc., hours for the locations, and so forth. But if you could not physically make it out tonight, we beg you to please come to the festival and come visit their booths, because, I mean, these folks are working their tail ends off and really trying to help the community in the best way possible. And we would like everybody to be educated, informed, and just, we want to strengthen our entire community. And we feel that education, cross education, is the best form to do that. So with that, we're going to, well, I'm going to stop talking now, and you're more than welcome to come up and individually seek out information. And thank you, Facebook Land, for tuning in, and we'll